Hey guys, Dr. Justin Marchegiani here. Today we're going to be talking about ear infections. It's that time of year. I have a son right now with an ear infection, so I'll tell you what I'm doing, how we try to prevent, and if we have to treat, what we can do as natural and then kind of progress to more conventional if need be. All right, so let's dive in. Before we do, please smash the like button. Love to see you hit the subscribe and bell for notifications, and put your comments down below. Let me know what's working for you, and I will be responding to those. All right, so we got two major kinds of ear infections. This time of year, you're going to be dealing majorly with inner ear infections because people aren't going swimming. You have the swimmer ear or the outer ear infection. That's usually stuff going in, pond water, pool water, and there's some kind of a bacteria that kind of grows, and that can inflame that tympanic membrane or the eardrum from the outside in. And then we have our middle ear infection, which is basically connected to the sinus cavity and that eustachian tube not quite draining from that ear, and that fluid backs up, and then you can have bacterial or viral issues driving a lot of that fluid or that mucus from being sludgy and sticky in the first place. Let me just kind of dive in and show you a little bit what I'm talking about. So kids are a little more prone. As you can see, here's our nose. We have this eustachian tube right here. And adults, you see how that pitch? It's got a much greater pitch, steeper pitch. So fluid can drain much easier if you're an adult. And then when you're an infant / toddler or kiddo, that is much more flat or parallel. So you don't have the pitch there to drain that. And so typically what happens, you either have a viral or bacterial issue coming to the nose typically. The nose is a great place for bacteria and viruses to reproduce. And as they reproduce, they create more inflammation. So then these little tube here that drains can get narrower. So it can get narrow. And then obviously you're going to have more mucus in there because the mucus is a result of the white blood cells. So the white blood cells are going and they're attacking the bacteria or virus that's up there. And it's going to create white or green and yellow mucus. The darker the mucus is, so yellow to green to dark green, that means the more white blood cell soldiers are dying and trying to kill that bacteria and virus. So the more green, the more deeper the infection is, but it's also good. It means your immune system's working, but you got to get those soldiers, you got to get the infantry that is passed, so to speak, off that battlefield so it doesn't create more infection, so it doesn't create a lack of drainage. And so we'll talk about, done videos on this where we show nasal irrigation strategies. We won't do it in this video. We'll probably link up down here below or at the end of the video. You'll see a link for that video where you can watch the whole thing completely. But essentially we are flushing saline, high quality saline, using an RO or high quality distilled water, RO being reverse osmosis. We're flushing that up, mixing it with a good saline packet, which is sodium chloride and bicarbonate, maybe a drop or two of iodine or a full milliliter of high quality nano silver, which will help knock down viral load. And the saline by itself will also help knock down bacterial load. So we kind of work on it on both sides because it could be a viral issue. This is why so many, pediatricians just throw antibiotics at this, but a lot of times it's still a viral issue. It may result in a secondary bacterial issue, but it still may be a primary viral issue out of the gate. And this is why you want to use saline and some kind of a, couple of drops of a good providone or betadine, iodine in that 8 ounces of saline, and or a milliliter of silver. That way you have some potent antiviral options. Also, silver and iodine can also act as a biofilm, so it does knock down the bacteria even better. So I like that. We flush that out 2 to 3 seconds each nose. And then we also use the Xlear Rescue Spray. The Rescue Spray has parsley, oil of oregano, tea tree, about 6 different herbs, grapefruit, a lot of them having antiviral and antibacterial qualities. So we add in the saline, we add in the iodine or the silver, and then we add in that Xlear Rescue before and after to really break up the mucus. And that saline flushes out the junk. Now, if that junk stays in there, it's going to block this from draining. And then, of course, over time, this could cause the eardrum to rupture. So with my son right now, I have a little eardrum issue as well. He also was in a pool last weekend. So it's a combination of pool and maybe middle ear. Got a lot of junk coming out of his nose, so we're flushing and irrigating every couple hours, getting all that mucus and junk out. As long as I see yellow or green, every 2 hours we're flushing. Every 2 hours we're flushing. I'll do that Xlear Rescue Spray before and after. The Rescue Spray with the xylitol and the 6 different herbs, it breaks up biofilms. It also breaks up mucus. It's like putting a little bit of Dawn dish soap on a greasy pan. Right, let it sit for a minute and then rinse it off. It kind of breaks up that surface tension and kind of emulsifies the mucus. And then when you flush, it comes out better and easier. So why are children more prone? Flatter eustachian tubes. Adults have better drainage. Now, why does that mucus get in there to begin with? Well, we talked about ear infections, bacteria or viral. This is a good article. You can have allergies, cold sinus, again, viral, bacterial. Conventional medicine will never address viral issues, and a lot of times viral can progress to bacterial. So I always assume virus, but then we put the iodine or the silver in and use the rescue spray. So if there is a bacterial issue, we're getting it out. And then again, the swollen lymph nodes, that'll just be a result of your immune system trying to grab up all that junk. You can also gargle too. That will help with the adenoids or the lymph stuff or the tonsils. You can gargle with that same quality sea salt formula. That'll at least help with the drainage, help scrape off some of that bacteria junk as well. So here's your inner ear. This is what an inflamed ear looks like. So you can see, let me show you normal first. So you can see nice, clean, right? Like whiter, like pinker, not as inflamed, not as red. You'll have some blood vessels, right? There's the cone of light. So if you're looking at it through an otoscope, you would see that little bit of a shiny guy right there. And then you have your bones here, your malleus, your incus, and your incus, and your stapes. By the way, Jeopardy question, what are the 3 smallest bones in the body? You're looking at it. Malleus, incus, and stapes right there, or incus and stapes. And then here's your inflamed. So you can see here's your malleus. There's your bulging eardrum. So you can see the cone of light would be right there. And so it'd be right there. So you can just see all the vascularity, all the redness, all the inflammation. And you can see the bulge right here as well. Much smooth. You just look at the contour right there, much more smooth. And then you go here and you can definitely see that bulge. So that's the difference between what these eardrums look like healthy versus not. So some parents have their own otoscopes. They have some nice cool app devices that plug into your iPhone, and you can, as long as you don't go in too far and you have a cover on that and you sterilize it in between your kiddos, that way you can look at it and you can see, and it just gives you a good visualization. Worst off, take them to a pediatrician, at least get it visualized to know most of these issues, wintertime, you're not in the pool, it's going to be a middle ear. Now, that being said, if it's a middle ear issue, you can't get to it from the outside. So antibiotic ear drops, or let's say you're going more natural and you want to do hydrogen peroxide, or a garlic and mullein oil, or a citricidal grapefruit seed extract, right? These are all good options that are natural to topically get it. Now, if that middle ear infection becomes an outer ear infection because it bursts, because that tympanic membrane breaks, and you got to be careful, but you can at least get things on the outside in. So if you're doing topical antibiotics or topical corticosteroids for pain or inflammation, you can. Again, I had a long list of issues as a child. I had tons and tons and tons and tons of ear infections as a kid. Now, what was the root cause? I ate a lot of gluten, a lot of sugar, a lot of dairy. And so the driving factors of that mucus we talked about over here, I didn't highlight it enough. I'm going to highlight it more. We talked about colds and sinuses. That's common, but what drives a lot of the mucus? What drives it? Gluten, dairy, any processed sugars and flours. That is going to cause your body to produce more mucus. So if we already have an infection, bacteria or viral, it's already brewing, we're having some mucus, we're having some discharge, we're flushing it out, we're seeing yellow to green, that means more white blood cell activity. And then we also eat more mucus-forming foods, dairy, even potentially butter. When I say dairy, I'm more talking about like cheese and milk. Butter, the casein content and the lactose content is pretty low. It's mainly butter fat. But more dairy, more sugar, more processed grains or flours, that's going to cause more mucus. So if you already have a high level of mucus, that could be enough to tip you over the top. Plus any flours and things like that, the sugar is going to decrease your immune function. So it's going to make it harder for you to knock down that virus or bacteria internally. So we're going to work on flushing and irrigation. Number 1, we're going to cut the root cause, which I think is the mucus producing inflammatory foods. Number 2, we may add extra anti-inflammatory support. We may add extra curcumin. We may add in extra boswellia or frankincense. If you have to do a pharmaceutical, feel free to look up your kids, height, or age and weight, right? If you're doing an ibuprofen, wait the correct 6 hours. Be very mindful. If you do Tylenol, like let's say you're stacking 200 milligrams of ibuprofen every 6 hours for your 6-year-old, right? Based on the time schedule. Let's say you have to go in between using Tylenol. If you have to do Tylenol, make sure you add a little bit of N-acetylcysteine in, because Tylenol will deplete glutathione. You can look at it in the peer literature. Hey, while you're right here, let's just do that right now. As you guys can see, I bring the receipts. It's very important. Parents take Tylenol all the time for their kiddos, and they don't take a little bit of NAC with it. Right here. Acetaminophen affected the concentration and reduced form of glutathione, primarily hypothalamus. Let's go find another one here. Right here. Acetaminophen decreases intercellular glutathione levels. So that's a big one. There's tons and tons of studies. NAC has been used IV for Tylenol overdose, people go into liver failure since the 60s or 70s. So this is a kind of a known thing. Even people in conventional hospital settings know about that. So be very aware of that. If you have to go to Tylenol, make sure you give them at least a couple hundred milligrams, maybe up to 300 to 500 milligrams of NAC if per dose. That way you're at least not depleting the glutathione, because you're getting a lot of oxidative stress happening up there, and now you're decreasing your own internal antioxidant to help with that oxidative stress. So root cause, we have inflammation from virus or bacteria. That's middle ear or inner ear infection. We have water from the outside, think pool or lake. That's your outer ear infection. I think I'm dealing with both right now. So we're hitting it with garlic oil. We're hitting it with citricidal drops. I'll do a little bit of hydrogen peroxide as well. You can go 50-50 or just full on 3% hydrogen peroxide. The nice thing about the hydrogen peroxide, it'll bubble if there's a bunch of junk in there, a bunch of bacteria in there, and it will clear out a lot of the earwax too, which is really nice. So I tell my kiddo, okay, we'll put it in there and then tell me when the bubbles stop. And then when the bubbles stop, then we just put a little tissue in there, dump it, kind of just give it a little clean out. If you're using a Q-tip to clean it, be very careful. I always choke up on it, so you only leave just the end you're wiping, and just try to wipe the outside. Don't go in deep and push, because you could push more wax and more junk out. Just try to wipe out what's visible on the outside and choke up on it so your kid doesn't, because if they're in pain, they could reflexively jerk towards you. So you put your hand here, support, and then just choke up, so you only have maybe that much, and then you can just gently wipe away the wax. Just be careful. I've seen kids hurt their eardrums not doing that appropriately. So we'll do the garlic mullein oil on the outside, hydrogen peroxide 3%. You can always cut it too. Half and half is fine. You can do silver. I'll do my citricidal grapefruit seed drops. I have 3 to 5 things on my medicine cabinet, so to speak, that I'll go to, and I'll rotate to, because you don't know if it's bacteria. Hydrogen peroxide is great at that, or you're doing some virus stuff, maybe a little silver. Flush out the nose every couple of hours. I'll typically start every 2 to 3 hours. If there's less green and less yellow, I'll extend it. The more green and yellow, the more I keep it nice and tight, because even if there's not mucus and junk up there, if there's virus and bacteria at microscopic levels, I'm still lessening the viral load or the bacterial load. That's helpful too. So really good. All right, hope that helps, guys. So in general, outer ear, topicals, and if you need to see your pediatrician to get an antibiotics like amoxicillin, or whether it's drops, I always recommend going to drops first. Drops work on outer ear, swimmer ear, or potentially a perforated eardrum. But again, once that happens, they may want to go to amoxicillin internal. So talk to your pediatrician with that. Again, I try to be on top of this with my kiddos. I'm making diet changes. I'm flushing out sinuses. I'm trying to do things internally as well, trying to give natural anti-inflammatories. If you have to go to ibuprofen, base it off of wait the 6 hours, and just be smart about it. It's good to have a pediatrician where you can kind of use these more acute situations, use them as a resource. But mostly, I would just say most kiddos are not, they don't have the toughness to be able to do the sinus flushes. So get your kids used to that, because if you can do the sinus flushes, pediatricians are not teaching parents about this, and it's a powerful way to get all that junky mucus, which in my opinion is clogging up that eustachian tube. Kids are more prone because that eustachian tube is more parallel, more flat, and so it makes it harder for mucus to drain. So keep that eustachian tube clean when they're going to bed at night. You can always give them a little bit of mucinex, which is really from the guaiac tree. It's a guaiac bark that does thin out the mucus. You can also do NAC to thin out the mucus as well. That'll keep it thin, so then it's less sluggish. And then you can always give them a little incline when they sleep to allow things to drain a little bit better. That's going to help too. If you have, I have my Theragun, and I'll use my little, I have a head. It's a soft cushiony head. Let me grab it 1 sec. So I have a whole body vibration as well. So I'll have them stand on the whole body vibration for 5 minutes just to get things moving. I have a red light too, so I had them up against it like this with the red light, helping to calm the inflammation. But this is great as well. So this head here is a lymphatic head, so it's very gentle and soft. Okay. I'll have it go on the lowest setting. Depending on how much pain there is, I avoid the ear, obviously, but you can go behind it in this auricular area right here and just small semicircles just to relax the lymph. And then gently, progressively go from head to toe. Go lower down, go behind the ear. And now I'm going semicircles right down the lymph nodes in the neck. And it's going to drain right down in the vena cava here. So I'm going to just have it all the way down. And just, you can lighten up. You can see I'm talking pretty well, even with it over my vocal cords. And have it drain all the way down in here. And then I can have it come right here as well, my chin. Because you have your submental here and your submandibular lymph nodes right there. And so you can just use this to gently move it around here, help it drain all the way down, drain back to the heart, which is great. That way it's going to allow your lymphs more capacity to allow more drainage throughout the night. So it won't be kind of at capacity, if you will. So we flush out the nose. We used to go to antibacterial, antiviral. We make the food changes to stop driving more mucus. Obviously, sleep's going to be good. We have the topical stuff inside for outer ear, or if it bursts on the inner ear, you could still use, but you may want to bring in some kind of a topical antibiotic or steroid if you need, or if you need to do oral antibiotics. I mean, the whole goal of this is I was that kid as, from age 1 to 5, 1 to 7, where I had probably 5 or 6 ear infections every year. So I was that kid, tubes, probably a dozen plus antibiotics. So ideally as parents, we want to be kind of aware of this and not over antibiotic. I could not create antibiotic resistance, not wipe out a lot of gut flora like I had personally. So these are the strategies that I'm implementing so my son doesn't have to go to the same path that I went down. So, but if you need to have that happen, you can this will prevent most of it from getting that severe. All right, guys, hope you enjoyed today's video. If you did, let me know. Put your comments down below. A lot of interventions here. We'll link to the sinus flushing video as well so you can see that. And I'll put some links to some products in the description below or a pinned comment of things that I recommend on the topical side. All right, guys, hope you enjoy. Take care.